This video is for Cardiff Critical Care and it is for the multi-access port closed suction system for adults. So what's going to come in the pack is our, what we currently call a Y connector, but this is now called a multi-access port, and it has this red stick which we are going to remove for use. We've also got our suction catheter, which again has this red part here, which we are also going to twist to remove. And then we have our catheter mount. I'm going to connect this all up for you to show you how it all sits inside the tube. So the suction catheter goes into this part here and gets twisted into place. And the catheter mount gets put into place like that. This then gets connected to your tube. And this part then gets connected to your ventilator. On coming out of the pack, the multi-site will be in the inline suction position. The multi-site will also give access to a bronch port and a neutral position, which can be used to maintain PEEP when changing the suction catheter. So initially you're able to put your suction catheter down into your tube and suction your patient, like so. We are going to pull this back by applying suction here. This locks and unlocks like our current suction does. Pull this back. Can you see this black mark here? We want to make sure that this is the other side of this before connecting our saline and providing cleaning to our suction catheter. What I'm going to talk about next is how to access the bronch port and the neutral position. This white button is how you will access these positions. As you can see, the whole suction catheter and tube is all in line, and this is how you are able to access the suction. Spin the multi-site a quarter turn clockwise to access the neutral position. Spin the multi-site a further quarter turn clockwise to access the bronch position. When in the bronch and neutral positions, you will not be able to access the tube with your suction catheter. So I've disconnected the multi-access port from the patient and I've still got my suction catheter connected. This is going to remain 72 hours to be changed. This remains at 7 days to be changed. When we are coming to change the suction catheter, whereas normally we would clamp our tube to keep PEEP in, we now have an option of using an access port in neutral, okay? So currently we are in the suction inline, so we can pass the suction catheter down. This multi-access port will allow us to spin into a neutral position. So if I show you the difference, so I've removed my suction catheter and you can see that there is a hole just here. When I'm pushing this into neutral, this hole is blocked off and is allowing the PEEP to stay inside the hole, which means that you could bring your new suction catheter and connect this without losing any PEEP for your patient. However, it's important to make sure that you're then twisting the site back towards open again, so that this is all in line once again, so that then you can use your suction catheter again. That's it. When you're using your bronch, again, it's the same principle. This bronch will be in line and you will flick the lid up to be able to access that port via the bronchoscope. The doctors will be the only ones using this. This does also come off, but usually will be kept on to obviously keep the seal. And always remember to close it, turn it back to the closed suction port so that you can access your patient in an emergency. We've also got stickers as well to put on, as obviously the suction catheter will remain 3 days. So whatever day you open this, you'll be able to use the sticker to go onto there. We also wanted to mention that this is an MDI port, which will not be used as we have the aerogen machine to provide nebulization. Our saline port is completely different, as you can see here, and they are also different sizes.